Okay, my name is Olivia and this is my NG video. The first thing I would do is provide patient privacy. Hi, Miss Betty. My name's Olivia. I'm going to be your nursing student today. I have a doctor's order to place an NG tube due to supplemental nutrition. Can you just verify your name and date of birth for me? Okay, perfect. Is there any reason that I wouldn't be able to place this tube due to head trauma or surgery? No? Okay. Do you have a preferred nose? Are both of them clear, like to breathe through? Perfect. Okay, we're going to use your left nostril then. I'm going to perform hand hygiene and put my gloves on. And then I'm going to raise the head of the bed to high Fowlers. I'm just going to remove your pillow from behind you. All right. I'm going to get a piece of tape ready. Perfect. Okay, Miss Betty, so we're just going to measure it to start from the nose to the ear to the xiphoid process. I'm going to place a piece of tape where it was at about 45 centimeters, just so that I know how far to go in her nose. Okay, and I'm going to lubricate it. And place this. Okay, Miss Betty, I'm gonna have you lean your head back, and then here's a cup of water, and when I tell you to, you're gonna take some sips, okay? Ready? 1, 2, 3. Okay, and now take a sip, and a sip, and a sip, and a sip, and a sip. Okay, we've reached the point, so we're gonna put some tape. Are you okay? Are you feeling okay? Perfect. And we're just gonna attach this. If at any point she was experiencing cyanosis or shortness of breath, we would immediately remove it. I'm just gonna place this on your chest here, on your gown. All right. There's that. I would do the bed lowered, wheels locked, call light in her hand, and the rails lifted, and then pain, potty, possessions, and positioning. Miss Betty, you're gonna go and get an x-ray to verify the location of your NG tube before it's used. And also, if you are experiencing any pain, you gotta let us know, okay? Great. So my documentation would be that it is January 30th. It is 14:30. I placed a 16 French NG tube in her left nair on the first attempt from a doctor's order for supplemental nutrition. She tolerated it well. There was no output. She was in high Fowler's position, and she was educated that she should let us know if she's having any pain or shortness of breath, and also that we got consent for why. She gave us consent, and I told her why she was getting this NG tube. And then I would just sign my credentials at the end of it, and again I would confirm with an x-ray that the tube is in the correct position before ever using it. She didn't have any output, so if she did have output, I would say like the color or the thickness, something like that. Now I'm gonna remove it. So, hi Miss Betty, my name's Olivia. I'm a nursing student from WT. I'm just gonna provide you privacy, wash my hands, and put new gloves on. You have a doctor's order to remove your NG tube. Do you have any questions about that? No? Okay, great. So I'm just gonna unclip this. First, could you verify your name and date of birth? Perfect. Okay. Remove this. And I'm just gonna place that here in case I make a mess. Alright, Miss Betty, so this is gonna be on the count of 3. It should not hurt. Ready? 1, 2, 3. Perfect. Are you feeling okay? Great. Okay. Before I leave the room, I'm gonna clean her up and put the bed low, wheels locked, call light in hand, and the rails lifted. Pain, potty, possessions, and positioning once again. Miss Betty, you are gonna be started on a clear liquid diet, so we're just gonna ease in and we'll advance as tolerated. Do you have any questions for me? Okay, great. So my documentation would be today's date. Today is January 30th. It is now 1500. We removed the NG tube per doctor's order from her left nair. In one attempt, she was in high Fowler's position, didn't experience any pain. Her nose is not swollen, it's not red. She was instructed to let us know if she is experiencing pain, and she should keep the bed and raised for just breathing purposes. The tube is all here, so nothing's left in her nose or down her stomach. She did not have any drainage when I pulled it out. If it was, I would say the color or the consistency and how much. She was educated about her diet, and just going forward that we would ease into everything, and at the end I would sign my name and my credentials.